Hi, hello, welcome to the AGNI Nursing Academy. Myself, Gangaram. In the today's sessions, we are going to discuss about the newborn reflexes. In so many times, the question arises from the newborn reflexes topics, and it's very important topic in the upcoming our nursing competitive examinations. Okay, the first questions we will see in these sessions. MCQ along with the theory will cover both. Okay, the first question on your display: a nurse is assesses an infant by stroking the cheek near the mouth. The response of turning towards the stimulus and opening the mouth indicates. The question asked means the nurse on the infant stroking a cheek means child stroking near the mouth. The response the child is doing that stimulus, the child is turning towards the stimulus. From the which side the stimulus given, the child is turning towards the stimulus, like that question asked. Which reflex represents like that question asked? Option A is Moro reflex, option B is sucking reflex, option C is rooting reflex, and option D is tonic neck reflex. Okay, we'll see one by one reflexes. The Moro reflex means, first I will explain you orally, the briefly, and one by one in detail I will explain. Okay, the option Moro reflex means what will happen? We'll hold the child in semi-sitting position. We'll hold the child in semi-sitting position, and the head of the child will lower down up to the 30-degree. That time child responses that the extension with abduction of the extremities followed by sharp flexion and adduction of the extremities will be occurs in the Moro reflex. Okay, I will explain in detail. Okay, sucking reflex means if any foreign object, if we are keeping in child's mouth, the child will directly start to suck that one will called as a sucking reflex. And the rooting reflex means when we are touching the around the child's mouth, the child will start to open the mouth and turning towards the stimuli. That one we will call as a rooting reflex. And D means that is a tonic neck reflex. The tonic neck reflex, what will happen means if we are turning head of the child towards the one side, the child in the same side the extension of upper and lower extremities will be occur, and the opposite side flexion of the extremities will be occur in the case of the tonic neck reflex. Okay, see here one by one I will explain you. Rooting reflex, when the child is touches the face, when we touches the face of the child, especially around the mouth, the response is neonates opens his mouth and turn his face towards the stimulated side. See here, child is opening a mouth when touches this side. Okay, that one will called as a rooting reflex. And the age of disappearance, the rooting reflex is disappears at the age of 3 to 4 months. At the age of 3 to 4 months, this one will called as a rooting reflex. Okay, see here another one is a sucking reflex. Observe here, when we are keeping finger into the child's mouth, that newborn's mouth, child directly it will start to suck. See, MS here, observe that one is child start to suck. Okay, that one will be called as a sucking reflex. The age of disappearance of the sucking reflex is the same as a rooting reflex. That one is a 3 to 4 months of age. 3 to 4 months of age. Okay, that one is a sucking reflex. See here, Moro reflex. Moro reflex, I told you, we hold the child in semi-sitting position and will lower down the head of the child up to the 30-degree. Up to the 30-degree. That one, that time what responses occurs means there is a sharp extension with abduction. Means extension means the joint between the body, the joint, the angle between body movements means joints, it will be increased. That one will be called as the extension. Abduction means the movement forward from the midline. Our midline, the movement from the away from the midline. That one will be called as a abduction. Adduction means the movement towards the midline. That one adduction. Flexion means the angle between the body joints, it will be degrees. That one will be called as a flexion. See here, just observe, when we are lower downing head of the child will extension of the extremities plus abduction. This first movement, this one will occur, followed by that one only the second movement occurs. The child will flex with adduction of the all extremities occurring in this. See, that one is the, this thing will be called as a Moro reflex. See here how the movements occurring. The child's hold is in some sitting position, lower down the head. Okay, this is the Moro reflex, and the age of disappearance of the Moro reflex is 5 to 6 months of age. 5 to 6 months. The Moro reflex in this, the bilateral means that is symmetrical. The both hands are equally flexion and extension, adduction and abduction movements is occurring. But in the some cases, what will happen? There is unilateral means asymmetrical movements will be occur in the some cases. The during the type of delivery, some injury can be occurs. In the what cases the asymmetrical Moro reflex occurs means, see here in the cases of the sometimes during the delivery, the dislocation of the shoulders will be occurred. Shoulder dislocation. Shoulder dislocations. Okay. And in the some cases, what will happen? The congenital hemiplegia. Congenital hemiplegia. After that, there is a chances of occur in the cases of there is Erb's palsy also. Erb's palsy. Erb's palsy. Okay. Means the spinal nerves, which is the brachial flexus, injury to the brachial flexus occurs. That one will called as a, that one called as a Erb's palsy. Erb's palsy. Okay. That one Erb's palsy. In these cases, asymmetrical Moro reflex will be occurs. If the Moro reflex, see here, the absence of Moro reflex in the scene in the case of Down syndrome. If the we are lower downing, we are giving stimulus to the child also, then also child is not responding. Means in the case of the Down syndrome, it will be occur. Okay. Down syndrome, the absence of Moro reflex we can see. Okay. If the Moro reflex, I told you, disappears at the age of 5 to 6 months. If it is continuous after the 6 months of age, means that is there is a something problem is there. In the cases of example, in the cases of the cerebral palsy, there is a chances of persistent after the 6 month of age. Moro reflex can be occurs in the case of the cerebral palsy. Okay. This is about the Moro reflex. I think if I have understand that one, what I have to telling. Okay. See here, another one reflex, asymmetrical tonic neck reflex. Means in the word itself it is there. Asymmetric means not a bilateral side, not a equally. It's a one side. Tonic neck reflex means tones means the movements, and neck reflex means neck movements. Okay. When we are turning the head of the child towards the one side, in the same side the child will extension of the extremities, both upper and lower extremities, and the opposite side flexion of extremities will be occurs. That one will called as a tonic neck reflex. Okay. The tonic neck reflex, it disappears at the age of 6 to 7 months. 6 to 7 months, tonic neck reflex differs. Some, okay, this one is the asymmetric ones, single side. We'll discuss symmetrical tonic neck reflex. Means if we are a flexion of head in the same movements occurs in the child's head and upper extremities. If we flex the head of the child, if we flex the head of the child, the upper extremities also flex, and the lower extremities occurring extension. Means see here, I will write here, head flexion occurs means upper extremities also flexion movements occur, and the lower extremities extension will be occur. In the lower extremities extension. This one is the first movement. See here, the flexion of lower extremities and the extension of upper extremities and head also. If the child is extend the head, same thing in the upper extremities, extension of the both hands occurs, and the flexion of the flexion of the lower extremities. Means if we are extending head of the child, upper extremities also extension occurs, extension movement. In the lower extremities, flexion. Observe the here image. Movements will be called as a symmetrical tonic neck reflex. It appears at the age of 4 to 6 months, 4 to 6 months, and it disappears at the age of 8 to 12 months of age. This is about the tonic, that is symmetrical tonic neck reflex. We'll see now our questions. In the question asked, the infant by stroking the cheek near the mouth, the child responds turning towards the stimuli and open his mouth. I told you the correct answer for our question, that is the option C, rooting reflex is the correct answer for our questions. Okay, now we'll see the next question now. A 2 year, that is 2 days old newborn is held upright with feet touching. Means upright means upper and lower movement. Upright with feet touching when it is flat surface. When the child touching the flat surface, the child is doing upright movements. Okay, and the baby makes alternate stepping movements also. Why? As if walking, the child is doing stepping movements also while it is walking. Which primitive reflex is being elicited? Which reflex is presenting like that question asked? Option A is motor reflex, option B is tonic neck reflex, option C is dancing reflex, option C is Landau reflex. Okay, means the motor reflex, I told you, will take the child in semi-sitting position, will observe the extension flexion of the extremities. Okay, tonic neck also, that is asymmetrical tonic neck reflex we have seen. If we are turning the head of the child towards the one side, the same side the extension of extremities occurs, and the opposite side flexion of extremities occurs. Now we will see the Landau reflex and the dancing reflex. Okay, dancing reflex means the same, will child hold in a, that is vertical posture when we allow the child to touches the child's leg to the flat surface, then child will start to stepping. That one it's look like a dancing. Because of that's why it will called as a dancing reflex. And option D, that one is the Landau reflex, means the child hold in a ventral suspension. If we are holding in a child in ventral suspension, means in the prone position ventral suspension will hold the child, that time the child's neck and the leg end will be elevated. That one will be called as a Landau reflex. See here, the correct answer for our question is option C is the correct answer for our question. That one is a dancing reflex. It is also known as stepping reflex, also known as stepping reflex. We'll see in detail here. See, Landau reflex means we'll hold the child in ventral suspension. Means in this position we'll hold the child. That time what will happen? The head end and the leg end of the child is elevated from the normal ventral suspension. Head end and leg end is elevated. That thing will be called as a Landau reflex. Okay. The age of appearance, in the age of 3 to 4 months it appears. 3 to 4 months, and it disappears at the age of 1 to 2 years. 1 to 2 years. It is also known as Superman reflex. Superman reflex, because of the child is doing a movement like this. See, this movement, it looks like a Superman movements. That's why Landau reflex is also called as the Superman reflex. Okay. See here another reflex, dancing reflex, or it is also known as a stuffing reflex. Okay, we will hold the child in vertical posture. See here, we are holding child in vertical posture. When we will touches the leg of the child, we are allowed to touch. That time child will start to tapping like movement. The up and down movement of the legs will be start. Rapid flexion and extension of extremities. That one we called as a dancing reflex. See here, hold the child in vertical posture, then allow the one or both lower extremities to touch on the flat surface. The child will respond rapid flexion and extension of the extremities. That one we call as a dancing reflex. Okay, it appears at the birth and it disappears at the age of 3 to 4 months. It disappears at the age of 3 to 4 months. See here, this one is the image of dancing reflex or stepping reflex. Okay, I told you in the question asked about the dancing reflex, the correct answer for our question, that one is the dancing reflex. Okay, see the next question. A positive Babinski reflex in the newborn indicates, means if the Babinski reflex is positive, what it indicates, like that question asked. If the Babinski reflex is positive, what it indicates in the newborn? Actually, in the newborn, what it indicates, like that question asked. Option A, spinal cord injury. Option B, normal neurological development. Option C, cerebral palsy. And option D is lower motor neuron lesions. Okay. We'll see first about the what is mean by Babinski reflex. See here, Babinski reflex means we'll take one blunt object and sole on this foot of the sole. What will stroke the object from the heel, from the lateral side towards the, that is the little fingers, from the little finger to ball of the toy. See here, the ball of the foot. See here, he's taken one blunt object and start from stroke from lateral side of the sole towards the first little finger. From that will curve, from the curve towards the ball of the foot. That time what will happen, the in the children's newborns child is dorsiflexion of the big toe, means here there is a ventral surface. Okay, and this one is the dorsal. Okay, that time what will dorsiflexion, flexion means what will, the angle between the joints, it will be decreasing. Dorsiflexion of big toe and the hyperextension of little fingers. Hyperextension of little fingers movements occurs. That one will be called as a positive reflex. It's normal up to age of 2 years. The positive Babinski reflex is the normal up to the age of 2 years. After the age of 2 years, there is a flexion. See here, flexion of the little fingers and the both big toe. The both flexions movements will be occur. That one will be called as a plantar flexion. Called as a plantar flexion movements. That is normal after the age of 2 years. After the 2 years of the age also, the same movements is occurring, means the positive Babinski reflex after the age of 2 years, that one will called as a, there is a problems occurs in the neurological abnormality. Neurological abnormality. Okay, means if the after the 2 years of the age also, same dorsiflexion of the big toe and hyperextension of little fingers movements is occurring after the age of 2 years, because of there is a abnormality present in the neuron, and neurological abnormality is present. Because of that's why the positive Babinski reflex is occurring after the age of 2 years, like that we will suspect. Okay, and after the 2 years of the age, in the normal adults, normal movement is there is a plantar flexion of the extremities. Okay, the normal movement, and the normally it appears at the birth and disappears at the age of 1 year. 1 year, it can be up to the, it can be persist up to the age of, up to persist age of 2 years. Okay, age of 2 years, that one called as the Babinski reflex. The correct answer for our question is will assess the normal neurological development in the case of Babinski reflex. Correct answer for our question is option B is the correct answer for our question. That means normal neurological development will assess in the newborn in case of the positive Babinski reflex. Okay. Next reflex now. What is the age does doll's eye reflex disappears physiologically? Means normally, functionally, when it is disappears, doll's eye reflex, like that question asked. Doll's eye reflex disappears physiologically. At what age? Like that question asked. Option A is birth to 1 week. Option B is 2 to 3 months. Option C is 6 to 8 months. And option D is 1 year. Okay. First we will see what is mean by Doll's reflex. Doll's reflex means, see here, when turn the neonates heads, when we'll turn the neonates heads towards one side from the right to left, what will happen? The eyes of the newborn, it's do not adjust immediately to the new position of that. If we are turning head of the child towards one side, the immediately after the movement, the eyes of the newborn, what will happen? The turns towards the opposite side. Immediately it will not cover the new position of the head. That reflex we will call as a doll's eye reflex. Means everyone seen once the dolls. If you are doing a movements of the dolls like that only, the opposite movements occurs in the doll's eyes. Like that only movements occurs in the newborn. Because of that's why we'll call it as a, this one is the doll's eye reflex. Doll's eye reflex. It disappears at the age of 3 to 4 months. It disappears at the age of 3 to 4 months. Okay. The correct answer for our question is option B is the correct answer. That is the doll's eye reflex disappears at the age of 2 to 3 months. Option B is the correct answer for our questions. We'll see the next reflex now. See here, a 2-week old newborn is placed in prone position. 2 weeks newborn, the child is placed on prone position, and the nurse strokes, means giving a stimulation, directly stroking with finger and all, along one side of the paravertebral region. Means child kept in a prone position and giving a stimulation to the lateral side of the vertebral region, one side of the paravertebral region. The infant laterally flexed the trunk, means the trunk of the child is laterally flexed, one side flexed like that, spelling to the stimulated side. From which side stimulated, in that side only the child is flexing the trunk. That one we call that representing this one is the movements which reflex is testing, like that question is asked. Option A is parachute reflex. Option B is Gallant reflex. Option C is Babinski reflex, and option D is tonic reflex. Okay. Already we have discussed tonic neck reflex. The child is doing a movement in this. In the head movement we are doing, and the same side extension of extremities is doing in the tonic neck reflex. We are not discussed about the in the tonic neck reflex, Babinski reflex, Gallant reflex. In this three reflex also will not discuss about the vertebral region and the trunk movements. Okay, and not mentioned anywhere about the trunk and the movements to the stimulate, like that. These three reflexes also we have discussed. Only pending reflex that we have discussed the Babin's reflex and tonic reflex also. Now we will discuss about the Gallant reflex and parachute reflex. We'll see. Everyone understands the question. Just see the answer for that one. I will explain you. Gallant reflex means will hold the child in ventral suspension. Means from the prone position, like that prone positions, we will hold the child and we will give the stimuli to the lateral side of the trunk. When we are giving lateral side of the stimulation to the lateral side of this trunk, in that same side only lateral flexion, the lateral flexion of the trunk towards the stimulated side movements will be do the child. That one we will call as a Gallant reflex. Okay, Gallant reflex. The Gallant reflex is disappears at the age of 3 to 4 months. 3 to 4 months. Okay, 3 to 4 months. That one, this one is the calendar reflex. Now we'll see the parachute reflex. We'll hold the child in ventral suspension and will lower down the body of the child towards the surface and lower down. What will hold the child and will doing what will movement will do means will, like that, lower downing the child. That time the automatically child will extension of the extremities will do, means to protect the self. It is the parachute reflex is also called as, that is a protective reflex to prevent injury to self. What child will do means the extension of the extremities will be do when we will lower down the child. That one will called as a parachute reflex. See here, hold the child in ventral suspension. Hold the child in ventral suspension and suddenly lower down the body towards the surface. In the flat surface, we will lower down the body. That time, extension with abduction of extremities will be occurs. That one will be called as a parachute reflex. It appears at the age of 6 to 7 months. It appears at the age of 6 to 7 months. Parachute reflex. See here, now we'll see the answer for our question. The correct answer for our question is option B is the correct answer for our question. That is the Gallant reflex is the correct answer for our question. Okay. Now we'll see the next reflex again. Which of the following is typical response seen in positive Perez reflex? Positive Perez reflex. In the which movements we will see in the positive Perez reflex? Like that, the question asked. We will see the option. The infant is turns the head towards the stimuli. Option B is the infant is flexed legs and arms. And option C is the infant extends the spine and sometimes urinates or it cries. And option D, the infant performs stepping movements. The infant is doing stepping movements. We'll see one by one option now. The infant is performing tapping movements. That one is called as a tapping reflex or dancing reflex. We'll call it or dancing reflex. Already we have discussed. See here, the infant turns head towards the stimuli. The infant is turning head towards the stimuli. First reflex we have discussed, that one is the rooting reflex. Rooting reflex. Okay. The infant flex leg and arms. There is no specific reflex present in this moment, but in the motor reflex, when we are child is lower downing, that time the flexion of legs and arms will occurs in the later the last movements will be occurs. First extension with abduction of movements occurs, followed by that one only the flexion of the upper and lower extremities will be occurs. That one will be called as a motor reflex. But in the only the flexion of legs and arms movements which is not present in any reflex. Okay. The infant extends the spine and sometimes urinate and cries. The correct answer for this question is option C. I told you in detail. Option C is the correct answer for our question. That one is the Perez reflex. See here, Perez reflex. Perez reflex means will place the child in prone position. Will place the child in prone position and will give stimuli from sacrum to head by the thumb compression. See here, thumb compression is doing. By the thumb compression, will start the compression from the sacrum towards from sacrum to head. That time, child we will do the spine movements, and sometimes the child will cry, and there is a flexion of extremities, and the lordosis of the spine movements will be occurs in the child. That one is called as a positive Perez reflex. Positive Perez reflex. Okay. It disappears at the age of 4 to 6 months. it disappears at the age of 4 to 6 months. This is about the Paras reflex. Okay, I think you have understand. And some other reflexes also there. One thing I want to discuss about Palmar reflex. Palmar reflex. Okay, if we are keeping any object on the palm of the children, the child will start to hold the object, start to grasp the object through the palm. That one will called as a Palmar reflex, and it disappears at the age of 3 to 4 months. 3 to 4 months, it disappears. Okay. And another one reflex is the that means pincer grasp. Pincer grasp. Pincer means fingers, grasp means grasping. Grasp. Okay. The immature pincer grasps develops at age of develops at 9 months of age. Means the child, if we are keeping object on the surface, the child will start the grasp the object from the radial aspect of the hand, and child will like that child will go and the child will grasp the object in the finger. Okay, that one will called as a immature pincer grasp that immature pincer grasp reflex. It's developed at the age of 9 months. And the another one is the mature pincer grasp. Mature pincer grasp is develops at the age of 12 months. Develops at 12 months. Okay, means child will grasp the object through grasp the object object from index finger and thumb. Index finger and the thumb. If we are keeping object on the surface, like that, if we are keeping object on the surface, the child will use the this one is in index finger and the thumb. Directly, child will grasp the object from the thumb and the finger, the index finger. This reflex we will call as a matured pincer grasp reflex. It develops at the age of 12 months. Okay, I think we have almost all reflexes we have covered. Okay, definitely the question will arise from this topic only, and if the question asked means in this class only, the question we have discussed reflexes, from that only question will arise. Okay, just like that only some important topics we will discuss in other upcoming classes also. Thank you so much. Okay, we'll meet you in the next class.